So now that brings us to the second C, which is communicate. And the communicate piece speaks to the sensory or the afferent function of the fascial tissue. And the easiest euphemism that I've come to utilize here for this one is that our bodies are supercomputers. They're no different than the way that cars are manufactured now, in the sense that we have all these different sensors that are in these precise or specific locations that are constantly detecting the environment around us. When something is perceived as a threat, or even just any general stimulus that is observed or detected, there is then a corresponding signal that is sent to the brain, organizes that, and then sends back a specific motor signal to then accommodate or account for whatever that stressor may be. So with that, when we're thinking about the context or the confines of speed or of fast fascia, it has to start with a well-tuned sensory system in order to be able to have a fast processing ability or be able to detect. And I've said this a million times, but again, another good euphemism here is that our ability to detect creates our opportunity to respond. Now we'll touch on all of the more A and P and kind of technicalities of the sensory motor aptitude of fascia here in a second, but I actually think that this little segment is important to start out right here with what I define as being movement literacy. I think one of the things that gets a little bit pushed to the side in the coaching world is the acumen of education or teaching the athletes what we are trying to prescribe. And that's not to say like breaking down periodization and programming or things like that, but as it applies to movement, we just see a lot of these things as being rudiment concepts or elementary in nature. So we just start throwing things out, and then we're more focused on generating a sweat or producing fatigue or what have you. But I think over the years, I have continued to gravitate more and more towards seeing the role of a coach or a practitioner as being an educator at heart. And we need to take this with a little bit of pride in that we are really tutoring or teaching people to move better or move in a more mechanically efficient way than they were prior to our introduction. A critical step in any learning endeavor or skill acquisition is first unlearning the faulty input that was previously acquired or laid down. This again is something that I think just gets slipped through the cracks, where we almost invariably focus or emphasize doing something new or doing something different without first going through an unlearning process. So a really simple example of this is if we take the concept of spring ankles. There's never been an athlete that I've worked with that hasn't been in a 4-foot center of pressure, positive shin angle over knee over the toe position before. However, they have only done it based on how they interpret it, based on how they've seen it from somebody else, or it's just been verbally cued from someone else. So when we start getting into the nitty-gritty of the positioning of the foot relative to the hip, and we think about the distribution of pressure between the big toe and the pinky toe, and is the displacement of the heel more medial or lateral, we start to really quickly uncover that there's a lot of, take this with a grain of salt, poor habits that we need to work back from first before we come in and say, okay, hey, I need even distribution between pinky toe and big toe. I need you to rotate your heel slightly away from your body, push your shin angle forward just a little bit more, and then drop your hip. And then when we get to that point, all of a sudden there's this like uncontrolled tremoring, and it's a massive stimulus for them. But if we didn't go through that process of kind of stripping away what was to produce or provide what is, we could simply put them in that position and then see it as being good enough, quote unquote, and then just rolling with it from there. But getting back to the point, the reason why this relates so strongly to sensory motor acuity or function is because the movement literacy is essentially a way that we are able to play on the concept or premise of interoception, or the body's detection of how we feel about how we feel or what we are doing. If we take a great quote from an incredible NFL Hall of Famer, Deion Sanders, look good, feel good, play good, is something that I think is pretty unanimous or ubiquitous across athletes. There's this unspoken or intangible confidence or swagger that is going to help potentiate a better, more precise, or even just more explosive ability to move when we feel like we are in control or we feel as if we are confident with what we are doing. So this unlearning process is going to come with some things that we need to be mindful of. First and foremost is going to be the vulnerability and the frustration that's going to probably be felt through this learning process. Nobody likes to be told that what they're doing is wrong or what they're doing is suboptimal. So there's going to be some level of emotional response to that. We also need to be comfortable with allowing them to make some mistakes and make some errors, right? I relate this back to when I always was working with tutors for all of my classes in undergrad that I was failing. And I think that a problem that I had at that time, and I didn't realize this until after the fact, was when I had tutors that would just show me the answer or just give me the answer. Sure, in the short term, that was preferred or something that I was looking for. But in the long term, I started to recognize, hey, if I didn't allow myself to make some errors, I didn't really retain the information or the adjustments that we were making. And I think for movement, it's the exact same thing. Of course, this is within reason, and our job is to, of course, never allow anybody to get hurt on our time. But subtle errors here and there are going to be fundamental for actually driving a true learning experience. And I think the arbitrary number that we can work off of here, and I wish I could cite this off the top of my head, we're thinking about 10 to 20% of what we're doing should involve some mistakes or some errors so that we can then turn that into a teaching point. On the learning side, this is where we want to start to think about challenging and being a little bit more critical thinking in nature. So we want to start to ask them how they're feeling about what we're doing, or we want to start to add second or third layers to what we're trying to put in and really start to challenge them a little bit with it. But this is where we also want to tie in that buildup of confidence and starting to feel like there's an evidence of growth, and then we can reinforce them through positive feedback and start to repair this trust and confidence. The biggest thing as it sits up here in this little schematic is that we have to put a great deal of appreciation to the refinement period, right? It's not just a matter of we have a problem, here's the solution, and then we're going to progress from there. This wheel turning, the refinement wheel here, is where we just over time marginally improve the constituent components of what we are trying to do. And through all of this is where we are actually fundamentally developing the sensory motor acuity that is going to be required for the task at hand. Now, as it relates to more of the A&P or the actual sensory motor properties of fascia, I've alluded to these perhaps a little bit throughout some of these preliminary modules, but essentially we start with the big rock, and this is from a really profound study from Robert Schleip a number of years back, that the fascial tissue is suggested to be embedded with up to 6 to 10 times the amount of proprioceptive bodies when we compare that to muscle tissue. Really, again, the central role, or I should say one of the central roles of the fascial system, is really providing this proprioceptive acuity and helping the athlete or the body really to understand where they are in space and understand what the stressors or the stimuli are in order to help produce this appropriate or corresponding motor response. Additionally, it's been suggested that fascia has about 200 million free nerve endings. How that's quantified is well beyond me, but if we compare that to the retina, we see that about 200 million is going to be more than what we're going to see in the tissue of the retina, which, again, one of those things where I think it just, if nothing else, makes quite an impression, and it gives us a good perspective of understanding how truly rich this sensory network is. With stimulating proprioceptors and mechanoreceptors that are found in fascia, we want to make sure we understand that it's not a tremendous amount of force or stimulus that's always required. Now, of course, in certain contexts or in certain times, yes, we do need to have a robust stimulus in order to drive a sensory motor response. But in some cases, it can be, as it's listed here from Jan Wilk, as minimal as about 3 kilograms or 6 or 7 pounds of force to create some level of alertness. So this is where I actually predominantly think to the manual therapy interventions and how this can help to facilitate not just movement, but speed specifically and force expression specifically to quote unquote pre-activate the that should say connective tissues that are surrounding the contractile tissues. But this goes back to that talk on biotensegrity, in that we are creating this almost like net of tension that is surrounding the contractile tissues. So manual therapy, and as Altus has done a beautiful job of over the years with their track to table concept, this is a way that I feel we can fast track getting the athlete into this transient optimal state in order to apply stress and load. Manual therapy can become very valuable for that sake. Additionally, we have to recall that there are more things going on than just the muscle spindles and the GTOs in terms of how the tissue or the body is detecting and preparing itself for the subsequent stressors that are going to follow. So interstitial fascial fibers are something that interstitial fascial fibers, which are particularly sensitive to terminal stretching and sustained pressure, are going to be among those kind of intangible bodies that we link into the previous points on using manual therapy for the sake of stimulating or potentiating a strength or a speed session. Different combinations of mobilization, stretching, band traction, or even just self-myofascial release concepts are going to help to potentiate the bigger structures by cueing in or touching this tensional network that is enveloping. I mentioned it briefly in the earlier module, but the piezoelectric effect, as it's defined here, is essentially what is going to augment the neuromodulation between sympathetic and parasympathetic balance. And I know that is quite a mouthful, especially for if you're more on the entry level of strength and conditioning and coaching. This might seem a little bit out there, but essentially what this is suggesting is the sympathetic and parasympathetic balance is what puts us in a quote-unquote optimal state to perform what it is that we do. Now, this is highly individualized and different across different populations, but nevertheless, there is some theoretical or proverbial optimal for each athlete. So by utilizing different combinations of manual therapy, stretch concepts, different isometrics, and our big umbrella of warm-up and movement prep, we can utilize different implementations to help drive this piezoelectric effect, which then, at least in theory, is going to put the tissue or the system in a better position to be able to go out and sprint or lift or do whatever. Ultimately, our job is to provide mechanical stimulation to an athlete for the sake of creating or generating a specific outcome. These outcomes are going to be predetermined or at minimum predisposed based on what this athlete's genetic factors are, their present training input and demands, and then whatever their previous injury and training histories are, is going to essentially determine what the outcomes or those adaptations are going to be. The other thing that should also be listed in here too is going to be the age and experience level of the athlete, because as the athlete matures and just gets older, these inputs are going to be received a little bit differently. And anybody who's over 35 can probably testify to that. But here we see it broken up as being either overloading, optimal training, status quo, or maintenance, and then insufficient challenges or underloading. And the reason why I wanted to include this slide specifically is to discuss the differences between overloading and underloading. We all know what we're theoretically trying to work towards. With optimal training, or what many will refer to as the supercompensation effect, this is what we're all aiming for, but clearly we all don't hit that, and we all don't hit that with every athlete or every person that we see. With that, we jump back to the overloading or the underloading constructs, and what most people will be quick to point to as it relates to injuries, specifically non-contact soft tissue injuries, is that it's an overloading problem. And I'm not necessarily saying that's incorrect. I just don't believe that is ubiquitously true. And in fact, my theory is that most non-contact soft tissue injuries are more due to, or more likely due to, an underloading problem. Now, importantly, underloading does not indicate or necessarily mean that, oh, we're not doing enough, so we just have to do more squats, we have to do more sprint work, we have to do more accessory work. That's not necessarily the case. I believe that the delineation between overloading and underloading can also be driven by what it is that we are doing. So when I suggest that we are seeing a problem with non-contact soft tissue injuries due to underloading, what I really mean by that is that we are probably doing the wrong type of loading in some cases. So what we want to think about here is, to make this simple, the delineation between conventional, contemporary strength and conditioning and a myofascial-based approach. If we have an appropriate load on the longitudinal structures, on the musculotendinous structures, those aren't necessarily going to be injured due to underload. However, the epimuscular connective tissue, if it has not been trained accordingly, so we are now back in this underload classification, this is where we start to see irregularity with fiber alignment and arrangement. Tissues will become more fibrotic, and that's due to a lack of flexibility and a reduction in strength. We will see an increase in cross-link formation, or essentially scar tissue. And this is where we start to create proportional difference or deficit between contractile structures and connective tissue structures. So what this ultimately leads into is that if we want to seek out the optimal training model, or this super compensation model, I believe it comes down to two primary things: our distribution between overloading and underloading, or between musculotendinous and longitudinal structures, and then myofascial and lateralized structures. We need to have good ratios between those in order to create the opportunity for supercompensation. And then thereafter, we have to focus particularly on the regeneration period, where not many of us have a difficult time doing things for the sake of improvement or for performance, but where we do tend to get things put on the back burner or get a little bit neglectful is on the regeneration period. And what I think about here is that if we have smaller valleys, we are able to reach quicker peaks. If we don't have this complete drop off after a training session that drives us all the way down here, we don't have to do all this work just to get back to a point of equilibrium. So essentially, in being proactive or preemptive with your restorative applications is not necessarily going to prohibit or absolutely remove any sense of soreness or setback or detraction, but it's going to make those regeneration periods smaller, and we're going to have less to work out of just to get back to a point of actual equilibrium.